and thanks to Speak Out Now for organizing this event. As you said, I'm a sociologist at Middlebury College, which is in the middle of Vermont. There was one thing you read about my bio that I'll just tweak, Jolene. That is that I did not travel the country meeting with people. I did them all. I did 100 interviews from my bedroom because it was the middle of COVID. So I couldn't go anywhere, which is really unfortunate because my normal work is to interview people in person and to travel and find people where they're at. And I only did one in-person interview for this book. And to me, there was some positives and negatives to that process. But anyway, I'll share my screen if I can for a second here. Let's see. Can you all see that now? Give me a thought. Okay, yes. Great. So I'll just get right into it. I'd like to give a little bit of a background to this book and the situation of American workers right before the pandemic. So I wrote another book in 2020 that was not about the pandemic. And that book was essentially about labor time. And the very short story that's called Worked Over, you see the picture here. The very short story to that book is that for 150 years in America, the hours of labor steadily declined from 100, from let's say 12 or 13 hours a day to 10 to 8 and almost to 6. So you see a photo here of some folks who were sort of aligned with the socialist labor left in the 30s, demanding a 30-hour week. You fast forward to 2012. This is a Walmart strike where workers have signs about wanting to work full time, stop cutting hours. Sort of, you see a demand for more hours, and this predicament sort of interested me, and I began looking into it. So in the 70s, we began to reverse course in terms of our work time. So what was the main struggle of the labor movement for a good part of a century, which was fewer hours, more money? That was, a central demand. And so from the 70s on, we reversed course. We now work about 13% more than we did in 1975. That's about 5 extra weeks per year of work. In other words, so we've increased our hours of work, not by working more than a 40-hour week, but by working more weeks per year. And in this book, I'll largely explain this happenstance by the decline of the struggle over labor time, over the control of the means to live our everyday lives. The who controls labor in any society controls time. When you see your friends, when you travel to see your family, often when you have children, when you take a break, when you go to the bathroom, when you eat, a lot of those things are determined by our employers. And so the struggle to control labor time, I think, is a really central facet of the socialist, communist, anarchist struggle, whatever you want to call it. And we've largely abandoned it. During the pandemic, when I finish this talk, I'll come back to that part a little bit. Suffice it to say, though, that when the pandemic hit, workers have been working more and more precarious hours than they had for close to 4 decades. Some people had too much, some people had not enough, and their wages had remained stagnant or declined. So it's sort of just a very base backdrop to this lead up in 2020. So I began research for the next book before that book was even done, actually, because I wanted to sort of understand that book was a demand for shorter hours, polemically. But, hundreds of millions of people had just lost their jobs in March and April. And I was unclear if that message would ring true, if it would seem unfairly judged. I don't know. I wasn't sure. So I began writing another book. The argument in this book is very straightforward, but I'll just go through it briefly so we can set the scene. Bad jobs for low-income workers are bad for all of us. Good jobs for low-income workers help all of us. In other words, that I wrote the book about essential workers, but in many ways, it's directed at other people. The essential workforce is about a third of the American workforce. Within that third, only a portion work face-to-face. So there are some, leaders in essential industries who work from home. And so I'm talking about frontline workers. The idea, in other words, their working conditions are our living conditions. In other words, if truckers have to drive all night to meet a quota for delivery, there are more accidents on the road. If healthcare workers are understaffed, there are more accidents at the bedside. If teachers don't have what they need to teach, our kids won't either. By the same token, if workers have a voice on the job, they are far more likely to speak up and point out hazards and workplace problems without the fear of retaliation on the job. And that makes things better for us. If workers at grocery stores in 2020 had the right to early PPE or access to PPE, if they had time off to get the vaccine, if they had good sick leave and paid sick time, they were more likely to be safer. That made our grocery stores and our neighborhoods safer places to go once a month or however often we went. This interdependence, I think, is very simple and very basic, especially to a lot of us on the left, but it has radical implications. The old labor slogan that an injury to one is an injury to all, or we're all better off if we're all better off. That whole idea is, it's true many times, but during the pandemic, it was almost statistically true. Like reality had a left bias. And I think we owe it to ourselves to really appreciate that argument and the power of it, because we all have a stake in making sure that essential workers, low-income workers, whatever you call them, the working class, has exceptional jobs with a lot of voice and a lot of power on the job, not just for them, but for all of us too, whether we work those jobs or not. So that sort of informs a polemical context for this book. The book is based on about 100 interviews with folks in healthcare, education, food processing, retail, grocery, logistics, other essential industries like that. I surveyed about 800 people before the 2020 election to talk about political questions before the election. And then I used a lot of proprietary union data that I got from unions, and a fair amount of, a good amount of sort of Marxist feminism thrown in there for good measure in a few chapters. It's a mainstream book, like it's, a book that's sold in Barnes and Noble that my parents will read. And so the idea also politically is to kind of Trojan horse in a little left Marxish analysis of the pandemic to the broader public. And so it's written at a very sort of undergrad 101 level as an introduction to some of these ideas. Why can't I change slides? Do you have any idea why that would be the case? 1 second here. Let me stop sharing. Let's see if that will change something.
PowerPoint just really wanted to drive home those central arguments because they're pretty solid arguments.
Yeah, they wanted to. Okay, let's see if this works. Sorry, everyone. Can you see that?
Yes.
Okay. Okay, great. So there's a fair amount of focus on healthcare workers. Originally, I didn't know what was going to happen with the pandemic, obviously. And so I began emailing and finding people to talk about worker safety. Do you have PPE? Do you have time off? Do you have sneeze guards? Do you have the stuff you need to do your job with relative safety? And that question always led to other things. And I spoke to someone, a healthcare worker named Kim. She was a traveling nurse, and she traveled from North Carolina to Oklahoma to Florida, and eventually requested being sent to New York City in April, which is when I spoke to her. And she'd been asked, even at that point, to staff a few strike contracts where nurses had gone on strike, or nurses had walked out, or they were short staffing or sticking out in some capacity. And she could have made 4 or 5 times her salary, which is already high, actually, at this point in the pandemic. And she said, she never took them. She said, that's the way we improve healthcare. That's the way we stay alive. You live fighting or die working. And at the beginning of this, when I started working then, that was the title of the book, Live Fighting or Die Working. The publisher did not like that title, but that is that was sort of the ethos of the book. And healthcare workers are really important in the story, not just because they were sort of the heroes of the pandemic or because they were so central to fighting the virus, but because they make up a increasingly large segment of the American working class. So this blue line is the growth of all jobs in other industries except healthcare. The other lines are healthcare jobs. You see the top one there being home healthcare services, the largest. When people think of the future of work, they often imagine like gleaming, things about like gleaming tech factories or robots or AI or whatever. The future of work is low-income women of color in scrubs making $14 an hour, taking care of people. Like that is statistically the number of people who we are adding and will add to our economy as it continues to change. And we need 3 times as many of them as we are planning to add already. So there's a great, history to this about the rise of healthcare services that has to do with the aging boomer population and the mangled bodies that fell off of the industrial working class after deindustrialization. I grew up in a town like this in Bethlehem, Pennsylvania, where the largest employer was steel, and now the largest employer is healthcare. There's a fairly direct relationship there. But this data provides the material basis for focusing on that class of people. And I'm sorry to say that, again, this is happening. I don't know why, but I'll just have to try to make the best of it. So I'll go to the next slide, and then we'll stay on this one for a little while. Can you see that or not? No.
No.
Okay, hold on a second. Sorry. You can see that now. So
Yes.
The first thing I'll talk about is class. I'm a Marxist, and we talk about class. That's the thing. And so a really interesting thing happened early in the pandemic. I would say the first maybe, let's say, 9 months. And that is that when I was conducting interviews, I got a really interesting sense from people that they began to understand their jobs as being in solidarity or having a certain consciousness with workers in other industries, regardless of occupation, regardless of race, regardless of workplace. So this led me to this idea, the classic, E.P. Thompson's idea of the making of a class. So I'll talk early on. I'll read a few things of how this happened. To me, it happened a few ways. Perhaps the most important one was the hero cult, that workers understood that the public saw them as heroes. They appreciated some of that recognition, but also understood that it really tended to undermine some of their demands for safety. By definition, superheroes do not need protection. They don't need PPE. They don't need a full-throated critique of austerity capitalism. They don't need any of that. They just rise above the fray as individuals. And workers aren't like that. And they began to tell me, in interviews, they say, look, heroes or whatever, we just want a raise, or we just want the right to work one job only, or we just want more PPE, et cetera. So early on, I talked to a worker named Miguel at a hospital in Brooklyn. He was a janitor. And he said, this was at the time when New Yorkers were banging on pots and pans to sort of salute healthcare heroes. He said, I'm not proud to be working here. I hope my son gets a better job than me. Those people you hear clapping outside, they're not doing it for us. They're doing it because they're happy that they're not in here too. And they know how lucky they are. And when I hear it, it makes me sick. So he was sort of calling attention to the kind of resentment and frustration and pushback that a lot of essential workers felt toward the kind of liberal calls for solidarity or we're all in this together or that kind of thing. The other way in which workers expressed this solidarity was in action. So I was at this was something I did in person. There was a protest in New York of all kinds of essential workers, teachers, nurses, delivery drivers, some street cleaners, some other folks. And this is a woman who was talking about, she was a nurse talking to a teacher. Her picture is here at the bottom left with the sign that says, please don't call me a hero, I'm being martyred against my will. And she says to teachers, as nurses, we know that you will be short on supplies and staff as billionaires continue to not pay taxes. We know that you will bear the brunt of idealistic policies that only look good on paper. They're going to call you heroes while they don't give you what you need to do your job. But we do know how to prevent COVID. Every time rank and file workers stand up to defend policies that prevent the spread of COVID-19, you're saving lives that medicine cannot save. If you teachers don't get what you need, you should strike, and healthcare workers and other essentials should stand behind you and demand that the working class stop paying for this pandemic with their lives. So she was trying to draw attention to this sort of interdependent, intercollective, cross-occupational class solidarity that was sort of bubbling up. I heard, only these kinds of things from essential workers, tons of support for unemployed essential workers, tons of understanding of that was not sort of their fault. This unraveled, to make a long story very short. So by the time that, sort of Labor Day 2020 rolled around, Biden had expanded UI benefits. It did become easier to live without working as much on UI. Vaccines made going back to workplaces safer, and the coming election made it so that blue workers and red workers in the same workplace did really turn against each other. A lot of people I spoke with said, like, look, my conservative colleagues are trying to kill us by not wearing a mask and not getting the vaccine and whatever it was. And there was more sentiment against each other. So, for example, this is Francisco from a meatpacking plant in the Midwest. He said, no way that somebody sitting at home deserves more than someone out here on the front lines. When we say we're talking about essential workers, we mean people actually working. This is Caroline, a nurse from Buffalo. We're not all in this together. That's true. Some of us are out here working our butts off, and some of us are at home sitting on them. So the argument was not that these people were lazy, but that they were unfairly safe. Proximity to risk was the driver of the pandemic working class, as we talked about before. If you worked face to face, you were in it. If you didn't, you weren't. Teachers being the maybe exception here and there. And so what people thought was not these workers were lazy in the typical way that workers sort of disparage each other, but that they were unfairly safe and whatnot. And so that I heard a lot of people saying, like, look, I wish I could stay at home. I wish I could do that, but I have sort of responsibility, or I'm not lucky enough to get expanded UI now, or whatever it was. So the best way to see this decline and rise, or this sort of class consciousness, is to look at it in action. So I'll talk next about some of the organizing that happened. And I'll do this wonky flip of my slides again. Okay. So there's a few ways. When I was writing this book, as I said, I did not pick the title. And at some point, I was emailed the title to the publisher. And the subtitle was, how the pandemic transformed the long struggle for worker justice, which was good in a way. It made me look at a thing beyond sort of workplace safety that I hadn't been looking, and something I think I've been missing in some of my interviews. When I would interview people about workplace safety, at the end of those interviews, they began to say, I would say anything else, and then say, oh, by the way, there was a strike yesterday, or there was a sit-in, or a walkout, or a protest, or whatever. And most of my interviews were with people of color, and then most of them were with women, because that's who was overrepresented in the pandemic working class. And one interesting thing that happened, I think that the pandemic did, was help us to reimagine a labor movement and a racial justice movement that had far more in common. This is a historical blind spot for the labor movement. It is probably the historical blind spot. And so there was, I think, some cross-pollination of broad class politics and broad racial justice politics. BLM began to talk about the strike for Black lives using the language of labor, and labor activists began to understand that, well, Black and brown people were dying of COVID at a much higher rate. That was not because they were Black and brown. It's because they were inordinately exposed to the virus as essential workers. There's nothing about being Black that makes you more likely to die of COVID. And so that protest in the weeks of protest in the summer of 2020, after George Floyd's murder, did see a lot of really interesting labor and Black freedom struggle coordination. And I think that to some extent, leaders of BLM were also leaders of some of the pandemic labor organizing, like Chris Smalls. And so some of that cross-pollination was really important, and I think helped further some of the Amazon organizing, certainly at Bessemer and Staten Island, and some of the Starbucks stuff we're seeing now. Another interesting thing that changed, the urgency of the pandemic really meant that workers for a time took matters into their own hands. A third of the strikes in 2021 were led by workers without a union, which almost just doesn't happen that often in this country. There were very few large strikes in 2020, but there were very many small strikes. And so that grassroots sort of bubbling up stuff that happened in my interviews was eventually, categorized and understood by the Cornell Labor Center. Did a great job of mapping some of this protest activity. So that sort of uber democratic grassroots organizing that happened within, but also on the margins of the official labor movement, was really important. People also told me that they began to ask for larger demands, especially in healthcare. So where home care workers unions would say, we're planning to ask for, let's say, $2 or $3 an hour in 2019 as a raise. When 2020 came around, they're like, look, we need a $27 an hour wage here. Now, they didn't get it, but they got more than they were originally asking for, because the pandemic created a context where you could ask for big demands, and where the tight labor market did make those demands a little bit more salient. There was new flashpoints for nationwide labor activism, like Starbucks and Amazon, the UAW, and to some extent organizing and logistics. That stuff was really important and has continued to be sort of in the long shadow of the pandemic. I think the pandemic helped create a new cultural zeitgeist for the labor movement. I just wrote a piece for LitHub about kind of young, the degree to which young workers are the most supportive demographic of the labor movement today. I mean, everyone is sort of more supportive, but than they were, let's say, 10, 20, 30 years ago. But today, younger workers are leading that trend. And I think there was a deeper impetus for larger reform. We have the largest public support and largest in-workplace support for unions that we've had in decades. And we have the lowest public support in decades for like large corporations. And so those aren't great metrics, but they're a start to thinking about how the general public thinks about the world during an immediate aftermath of the pandemic. The last thing, there we go. The next thing I want to talk about is safety. early on in the pandemic, a lot of the organizing and to some extent it's faded, but even into 2022 was still about workplace safety. So I have a particular take on this, which I want to explain briefly. There's a few ways in which we think we get workplace safety. One of them is a macroeconomic argument, and that is that because people have the right to quit their job, that incentivizes employers to raise wages, standards, healthcare, whatever, because you can get another job. Economists, talk about this model, use this model here and there. I don't believe it's a good model. I don't believe it's even really a thing. It's very hard to just quit a job and get another one. And I don't think the threat of exit in that regard is really sort of all that it's cracked up to be. The other way we might get safe workplaces is through OSHA, and that OSHA regulates workplaces and therefore safety. OSHA responded to about, I think, between 6 and 8% of times that workers called OSHA to demand a COVID inspection during 2020. In other words, they basically did not do their job. I'm not trashing OSHA. I'm just saying it didn't work during COVID for whatever reason. The other way is through union organizing. And unions have long been guarantors of workplace safety. I won't go through all the ways, but I listed a few here on the slide. Unions were really important in getting needle stick legislation in hospitals and nursing homes, which really cut down on hospital-generated infections in healthcare. Union membership is associated with smoking and alcohol cessation. We don't carry knives on small planes or smoke on them anymore because of the AFA, Sarah Nelson's union. Unions in healthcare help to increase surge capacity in hospitals, which we don't have in America, and which would have been incredibly useful during the pandemic. Better healthcare, union workers have better healthcare coverage that allows you to see a doctor earlier on in your problem. So you can go see a doctor for a cough rather than emphysema. And that drastically reduces the cost of healthcare and the kinds of increases or betters the kind of outcomes that we get. So this played out in a really important way during the pandemic. So I did a research with some other folks, Adam Dean from GW, Athindar Venkataramani, who's a doctor at Penn, and Sim Kimmel, who's a doctor at Harvard Boston Medical Center. And what we found, we looked at two major hotspots of the pandemic. The first one was nursing home, which was the sort of epicenter of the pandemic. If you worked in a nursing home in 2020, it was likely the most dangerous job on the planet. So what we did was found a relationship between that and unions. To make a long story very short, if you were a patient in a unionized nursing home in 2020 to 2021, the time is at the top of the slide there, you were about 11% less likely to die of COVID. If you were a worker in that nursing home with the union, you were 8% less likely to be infected. Those are pretty big percentages given the sort of the size of the outbreak there. If you can imagine industry-wide unionization of the entire nursing home industry, that would be associated with about 8,000 fewer excess deaths from COVID. So in other words, in the place that it mattered most, at the time it mattered most, among a workforce that is disproportionately Black and brown and female, and with a population that is incredibly vulnerable, unions made life or death differences. And that, I think, is something that has gone sort of underappreciated. The graph next to it shows an Iowa school district. So we did research on red state school districts. What that data shows, if that scatter plot doesn't make sense, is that as your teacher workforce in a school district becomes increasingly unionized, they are more likely to demand a mask mandate and to enforce a mask mandate. This includes in places like Iowa, where mask mandates were illegal, like where the governor outlawed mask mandates. So the only way you would get one is if you fought for one. And the only way you could fight for one is if you could stand up to your district or to your superintendent and say, look, we want this change without fear of reprisal, without fear of being fired. So it makes sense then that not just having a union makes a difference, but having a strong union makes a real difference. I'm an elected school board official in Vermont, and I deal with, we negotiate with the union. And I've, understand the difference between a strong and a weak union when it comes to figuring out that stuff. I think I skipped the slide. Okay, no.
You're just at 20, you're at like 27 minutes, just so you know.
Okay, great,
Jamie.
great. This is perfect. So I'll stop. I'll just wrap up. So at the end of the book, there's like a polemical chapter, like the end of all these books that people like me write. So I'll focus on a few things I think this research shows. The first one it shows is that when workers have power and a voice and an organization, we are better off. The rest of us are better off, and they're better off, obviously, as well. But so anything we can do to increase the power of workers to get those things is good. We often think of the PRO Act as that thing, and it would be great if we could get the PRO Act passed tomorrow. However, I think what labor history shows is that if we're going to get anything nearly as good as the PRO Act, we're going to have to create a crisis large enough to get that concession first. That's how labor history shows we get big concessions. And so organizing in the absence of the PRO Act is absolutely essential. And to some extent, we're seeing some of that activity right now, which I'm sure some of you are being really aware of. So organizing to create a crisis, a productive crisis, large enough to get kinds of reforms that will allow us to organize. The last thing I'll say is sort of a soft ending, but I talked about heroism in the beginning of the presentation. And I think I don't want to be too cynical. Workers were heroes during the pandemic, but it wasn't just showing up at work that made you a hero. A lot of people didn't want to go to work. They went because they had to. And what was really heroic was being at the bedside and then being on a picket line, or being in the grocery store and then walking out. And that kind of activity, that was stuff that generated increased healthcare, increased wages, lower patient care ratios, increased access to PPE, better quality conditions that produced food. Like all those things were benefits that rippled out from the workplace to all of us. And that heroism, I think, has been largely ignored or forgotten in the years since we've sort of almost, as Jolene sort of alluded to, forgotten about the pandemic. So, and something that was at the heart of worker activism in those years. So I'll stop there and we can take some questions. Thanks so much for listening and for having me here.